You pick your skin off your face, lips, arms, or body. Do you pull air from your scalp, eyebrows, eyelashes? Do you do those activities when you're very much stressed or anxious? Do you do those activities because it gives you some pleasure, gratification, and reduces your tension levels? Then you should check out whether you have a body focused repetitive disorder. Hey friends, welcome to the Lung Mind channel education session. I'm Shakila Devi Perumal, specialist in pulmonary rehab, counselor, and psychotherapist. Today, I'm going to give you a small sneak peek on body focused repetitive disorder and some ways to manage it and what are the treatment options available out there in therapy. And a disclaimer, I'm not going to talk about any medications today. Let's dive into the session. UK alone, 2009 statistic confirms 5 in every 1,000 people have this body-focused repetitive disorder. And today I'm going to talk about only two main common disorders under this category. One is skin picking, clinically referred to as dermatillomania or excoriation disorder, and hairpulling, which is clinically referred to as trichotillomania. And these two disorders are classified under the obsessive compulsive spectrum disorder in the International Classification of Disease, ICD, and the Diagnostic and Statistical Manual of Mental Disorders, DSM. Many people pick at their skin once in a while, but sometimes it crosses the line into a condition called skin picking disorder. Skin picking disorder refers to repetitive involuntary picking at your skin during times of stress and anxiety. This is a type of obsessive compulsive disorder because the compulsive urge to perform those behaviors. People do those behaviors as a negative coping mechanism to achieve gratification and relief of tension at the cost of pain or damage to the body parts. For example, picking a scab or the skin around your nails can become so frequent, intense, that it causes bleeding, sores, and scars. Some people with this disorder repetitively scratch to try to remove what they see some kind of imperfection in their skin. This is a mindset of achieving a perfectionism. And the root cause, if you could go back and look at the root cause, it can be due to fear of failure, fear of rejection, or low self-esteem. Some people do nail biting, otherwise called as onychotillomania, and chewing of the cuticles, or lip biting or nose picking until it is painful or so, because they actually swap the pain into a gratification label in their minds to achieve this release of tension. Here, the connections between the parietal and the frontal lobe is lost, and a default mode is always appearing to be a negative with the root cause of low self-esteem and fear of rejection. The next form of disorder, as I mentioned, is the air pulling disorder. And people have this compulsive urge to pull their air in order to feel the texture of the air or taste the air. And this gives them a feeling of soothing effect, like a child sucking the thumb when they achieve that soothing effect during that action. So they actually have these kind of gratification by doing this air pulling. Sometimes this can extend to pulling others' air or their pets' air, and this might cause more of challenges to them in social interactions. And people can do these kind of skin picking or air pulling and spend a large amount of the time in their day, and it can last for a significant amount of period, like months or years. And sometimes they can actually temporarily stop for a while and then get back to this again because they cannot control the anxiety or distress, or which is due to their root causes of fear of failure or rejection or reaching a perfectionism, those kind of thoughts. When those intrusive thoughts come to their mind, these actions again appear in their life. And people, by doing this, causing damage to the body parts, can end up in shame and frustration and blocks their social interaction. They might avoid going out and avoid meeting their friends or any kind of social events. And severe form of these disorders like skin picking can also lead to cellulitis. So if you would like to check if you have those skin picking disorder or repetitive patterns of these behaviors, please do check out these questions with yourself. If you can say yes to most of the questions below, it is likely that you're affected by a compulsive skin picking or hair pulling disorder. During the past 6 months, does picking at your skin take a lot of time? Do you have noticeable scars from skin picking or hair pulling? Do you feel upset when you think about how much you pick your skin? Does picking at your skin get in your way of your professional or social life? For example, do you spend a lot of time covering up your sores before work or social events? Or do you avoid going to beaches or gym because of those scars? Treatments available in therapy. There are two main kinds of therapies. One is habit reversal training, which is based on cognitive behavioral therapy techniques. The idea here is the therapist helps you to identify your stresses and triggers and to replace it with some other activities as a form of distraction, such as squeezing a ball. And this will help to ease your stress and occupy your hands instead of picking your skin or pulling your hair. And the other form is the second type is the self-help or decoupling or stimulus control therapy. In this therapy, it is to change the environment and help you to curb your skin picking actions. For example, decoupling means distracting, which involves can also fall under distraction, where you are using a blouse or a bandage to cover your skin or to prevent your feeling of the skin. Okay, so that will help you to stop those urges to constantly feel the skin and pick on it, or constantly feel your hair and pull your hair. Okay, so what are the other forms of self-help available? The other forms of self-help are the mindfulness, yoga, exercise, definitely, it's a big yes, and biofeedback and hypnosis. And there are some tips available on the NHS, the advice on the skin picking and the body focused repetitive disorder. Those tips are available online, but I can actually give it in this video as I think it might be helpful for those who are listening to this. The tip number one is to keep your hands busy. Try squeezing a stress toy or putting a gloves to help you identify when you are most likely to pick your skin. And that falls under the already discussed therapies like habit reversal and decoupling. And second tip is to resist the picking for longer, testing your threshold of resistance and how resilient you are to stop this action, because realizing this is going to cause a negative impact on your body. So stopping that urge to pick. And the third tip is to take extra care with your skin when you pick it, like applying some moisturizer on the traumatized skin, or apply some skin patches, which are very much simulates the skin texture, and there are loads available around the market. So applying those patches, which will have two win-wins. One is it is covering, and so you're not actually feeling the shame or guilt or frustration going out. No one is noticing it. And the other one is to avoid some infection on that traumatized skin. And the fourth tip is telling your loved one to be a brake system. So telling them when they notice you doing those actions, tell you to stop. I remember that in some cultures, if in the childhood behavior, like sucking a thumb, continues in the adulthood, people used to apply neem oil, which is very bitter, to prevent those actions as a repetitive pattern. And this is one of the break system the elders impose on their kids or the grown-up kids to change the behavior. And the other tip is to keep your skin clean to avoid infection. And the next one is to don't let your nails grow longer, which actually prevents you to pick your skin or scratch your scars, or causing you that negative coping mechanism to come in place. Okay. And finally, also, don't keep any tweezers or picking implements in an easy access to your location, and that will prevent you to avoid any further damage to your skin or your scalp. So those are a few tips available online, and you can go and visit the NHS advice tips online on the skin picking. So I hope that this video has given you enough knowledge on the skin picking and the hair pulling, two main common body focus repetitive disorder. I would actually like you to spread this word on this education to your loved ones so that they can benefit from this education, and assure them there is therapy available, and they can actually come out of that shame, guilt, and get their potential out in their own vibrant way in the society. Thank you for listening, and please do share and subscribe to this channel for more.